Hello, namaste. Today we'll be discussing about acute abdomen. Before discussing about acute abdomen, let us define about the pattern of the abdomen. Okay, there will be vertical line, two vertical line, that is from right side, that is from left side. From the mid-clavicular line, we can draw over here. Okay, we can draw two line. Okay, till the lower part of abdomen, and then we can draw two lines, that is at the level of T12, that is subcostal lines, and next thing is what line? That line drawn at the level of anterior superior iliac spine, that is intertubercular line. Okay, now we can divide the abdomen into 9 quadrants. Okay, so we can imagine that things. So subcostal, okay, subcostal line, and then we have that line. Okay, and intertubercular line over here, and then line drawn vertically from the midclavicular line. Okay, that divides abdomen into 9 quadrants. Okay, so when we divide that things, this contains, okay, this structure over here, this part, this region over here is what that region is. Okay, so we can compare that things. So this side, and this side, this side. Okay, so we can illustrate that things in the figure as well. Okay, right side there is right hypochondrium, there is epigastrium, there is left hypochondrium, and there is right lumbar region, umbilicus, in left lumbar region, and the right iliac regions, and the hypogastrium, and the left lumbar region. Okay, so to understand the pathophysiology of the acute abdomen, we have to know the derivative as well. Okay, derivative developmental disorder as well. Okay, so developmental, what's the actual development over there? Okay, what's the actual development is taking place over there? Okay, so from the oral cavity to second part of duodenum, derivative is from, that is foregut. Okay, so foregut, and from the second part of duodenum, okay, mainly major manual duodenal papillae opening over there, from that is structure to transverse colon to third part, that is derived from, where? That is derived from midgut. Okay, and then transverse colon 1/3 till the anal canal, that is the derivative for hindgut. Okay, so these are the three derivative. Okay, so foregut, midgut, and the hindgut. Okay, every foregut will have pain at where? Pain with epigastrium regions. Okay, so every pain at epigastrium, my first approach will be, there is derivative. Okay, there is derivative of this structure, so there must be a pathology over these regions. Okay, any things that is taking place over these regions, my first approach will be that things. And in umbilicus means where? If there is midgut, so if there is any inflammation in midgut or something else, okay, that causes pain at umbilicus first. Okay, so pain will be around umbilicus or at umbilicus, that is the first approach over here. If the inflammation is going, or anything that is going over hindgut, in what means the pain will be at which region? Hypogastrium regions. Okay, so these are the three approaches for our case, or for every case we can see in the wall. Okay, and then so same thing. So what will be our differential diagnosis? When there is pain at epigastrium regions? Okay, so we can divide that things into medical and surgicals. And medically we have acute hepatitis, first differential diagnosis, because the liver is derived from foregut, and also we have lower lobe of pneumonia. Okay, late presentation, what might be there? There might be a chest pain or something else. So that pain will be localized, that pain must be over the epigastrium regions. Okay, and slightly extensive might be there to right hypochondrium region, left hypochondrium region, but our approach must be there, that is at epigastrium. And inferior wall MI is another differential diagnosis. Okay, so this is medically we can see hepatitis, okay, pleural effusions, and next thing is inferior wall MI, okay, peptic ulcer disease, acute gastritis. Okay, and then these are our differential diagnosis. Sometimes typhoid fever might be there, our differential diagnosis. Malaria might be there. Okay, so malaria is also one of the differential diagnosis of pain at epigastric regions. Okay, that is also called as pain at upper quadrant. Okay, and that is the things over here. So our differential diagnosis is a medical, are this thing is a surgically we have differential diagnosis like acute cholecystitis, okay, cholelithiasis, okay, and then perforation might be there. Okay, and so these are the differential diagnosis over here. Okay, for surgically approach. Okay, and then let us talk about let's talk about what? Let's talk about pain at umbilicus. Okay, if there is pain at umbilicus means what? Umbilicus means our differential diagnosis, our structure over this structure are, it is appendix. So most common differential diagnosis of pain in umbilicus is acute appendicitis. Okay, acute tubulitis, colitis. Okay, Meckel's diverticulitis. Okay, that is the things, my differential diagnosis for these things. Okay, so this thing, and then we have ascending colon infection, inflammation. Okay, and then there might be volvulus, but there that might not cause so much of pain. There might be abdominal distension over here. Yes, there might be a pain. Okay, might be a pain, sudden onset. Okay, and then so our first must be acute appendicitis. Okay, so my question over here is, if the pain start from the umbilicus, the pain must go towards the right sides. That is our suspicious condition for appendicitis. Okay, so if the pain at umbilicus shift towards left sides, so there is there any chance for appendicitis? Yeah, exactly, there might be a pain over umbilicus that is shifting towards the, radiating towards the left side. That is also suspicious for acute appendicitis, because cases like situs inversus, okay, malrotation of the gut, there might be a differential diagnosis for that things as well. Okay, so our approach must be with different things, right side, left side. Okay, so both things we have to approach for. Now we have approach acute appendicitis over here. Okay, and then why there is pain at these regions, why there is pain. Okay, so let us talk about inflammation process over here. So inflammation basic things is what? So initially when there is an inflammation, then there is suppose my inflammation is going over here or something over here. Okay, so when there is inflammation over here, so initially there will be transient vasodilatation for few seconds, few minutes. Okay, there will be transient vasodilatation, that is followed by, that is suddenly followed by vasoconstriction. Okay, this is the first process over here. There is lining blood vessel, there is blood vessel over here. Okay, so when then vasoconstriction take place over there, what happens? So the everything's must be come over there, lovely PC must be come over there. So if this is acute, the neutrophil must be comes. If the same condition that progress to chronic, then what a macrophage must come over there. Okay, so when there is neutrophil come over there. Okay, so to neutrophil come over there, what happens? So what happens there? Okay, then now the blood vessel probability increases. Okay, how increases? Because the endothelial cells gap increases. That causes what? That causes edema first. And then what happens? Because there is increased permeability. Okay, so hydrostatic pressure and oncotic pressures. Okay, so oncotic pressure, there is hydrostatic pressure more. So what happens? There is edema over here. Okay, so when there is edema over there, what happens? So what is our signs over here, with the presentation over here? So inflammation process going on, same things. There is what? There is initially vasodilatation followed by vasoconstriction and then increased blood vessel permeability. Okay, this is the three things over here. Okay, neutrophil different step over here, but my approach over here is when there is swelling, when there is edema, there is swelling first things. Okay, and when there is inflammation process going on, there is fever, my second things over here. Okay, and when there is inflammation is going on over here, there is release of cytokines and different things. Okay, that will cause pain over here. Okay, so my differential diagnosis, my symptomatic approach for acute appendicitis will be pain, and there will be swelling over here. Okay, there might be edema, there might be swelling over there. Okay, the temperature might rise over there, that is localized, that is pyrexia. So to be fever, what happens? When the same cytokines goes to bloodstream, reaches bloodstream, and that goes and disturb the hypothalamic set point, and that condition is called as what? That condition is called as fever. So fever can be defined as when the axillary or body temperature, when the axillary body temperature exceeds 100.6 degree Fahrenheit. Okay, with disturbance in hypothalamic set point, and that condition is called as fever. Okay, so to be fever, to most fever, what happens? This we have to suspect over here. Okay, so acute abdomen, we have this approach over here. Okay, so the acute appendicitis, there might be a pain. Okay, pain, tenderness at McBurney point. There might be a fever. When the localized infection, localized cytokines releases to bloodstream that disturbs hypothalamic set point and that causes fever. Okay, there might be a swelling. We cannot palpate the swelling, but we can feel that things, and there might be a pyrexia over that regions. Okay, that is the things over here. Okay, and next thing is what with these things, and next things our main approach will be what, because there is construction is going over there. Okay, so what happens, that is a response. Okay, when there is reflex spasm, there will be vomiting. Okay, so vomiting content will come out. Okay, vomiting, we have to look for amount. Okay, bile stain or non-bile stains. Okay, so this is the approach for us, acute abdomen. Okay, acute abdomen approach, this is the things over here that acute appendicitis can be confirmed with this suspicious with this symptoms, clinical feature. Okay, and then moving further towards the pain at umbilicus, pain at epigastric regions, what happens? So what are the differential diagnoses over here? So we can suspect the structure, there is inflammation going in transverse colon 1/3, single colon, rectum. Okay, and in these regions we have to suspect more things, because uterus, okay, the pathophysiology related to uterus, because the anchor is derivative from different these things. Okay, so uterus, we have different things. Okay, external genitalia. Okay, male, female, different things over here. So main common presentations of acute abdomen, and main thing is pain at hindgut, means we have to suspect with differential approach. Okay, there might be what happens, there might be a uterus pathology. Okay, and there might be kidney renal system pathophysiology, and there might be abdomen, there might be GI tract abnormality as well. Okay, so these are the approach over here. This approach we can confirm there are different things, there are different differential approach for these things. Now with this we approach the things. So now we can define, how do we can define acute abdomen? So acute abdomen means, so there is pain, there is inflammation process going on in any quadrant of abdomen. Okay, any quadrant of abdomen, and which is acute in onset, and that need immediate intervention. Okay, that need immediate approach. Immediate approach will be there for that things, that is called as acute abdomen. Okay, so now we can approach acute abdomen with these things. Okay, I hope you have understood acute abdomen. Thank you. Hope to see you again.